Hey everyone, and welcome to Nurses Notes 101. For those of you who don't know me, my name is Alexa, and I figured we'd do something different for today's presentation. So I usually just go over key topics that you would see on your nursing exams or on the NCLEX or on certification exams, like the CCRN. But today I actually want to go over a bank of questions that I have developed utilizing my past nursing resources, my present nursing resources, like up to date, the Lippincott textbook, and a few other textbooks that I've utilized to come up with questions that I think most emulate the NCSBN and the NCLEX. So it's going to be a two-part series. This is part one. Part one has 11 questions, and then the other part two, will have 12. So, to get started, this series is going to be on cardiac nursing. This could be utilized for your next nursing exam, or it can be utilized for an NCLEX review. Question one. A patient is diagnosed with left-sided systolic dysfunction. Which of the following are not expected findings with this condition? So, when looking at a question, the first thing you want to look at is what they're asking. So, at this point, they're asking what is not expected. So, we want to go over the topic that they're talking about. So, that topic is left sided systolic dysfunction. So, the first thing we want to do is look at what is common with this cardiac disorder. And the question's asking what is not common with this disorder. So, what we want to do here is look at the potential answers A to D and see which ones we think are not findings of left sided systolic dysfunction. All right, let's go through. So, answer A, echocardiogram with an EF of 55. B, heart catheterization with an EF of 65. C, patient has frequent episodes of shortness of breath, especially when lying down. And D, option A and C are both not expected findings. So, what I want you guys to think about is this question is pretty much asking with a patient who has left sided systolic dysfunction, would they have a normal ejection fraction? So, I want you guys to think about this. Between each question, um, take about a minute. Don't take longer than a minute to answer the question. Pause the presentation right here and then get back to it when you think you've had the response. I'm going to go on to the next slide and we can talk about the answer. Okay, so answers here. It's going to be D, which is option A and C. So both of these, sorry, there's a typo here. So both of these are not expected findings of left-sided systolic dysfunction, and that's because since there is systolic dysfunction, the ejection fraction should be predicted to be lower. A normal EF is 1 from 50 to 65, so these are both normal ejection fractions. However, with a patient who's diagnosed with left-sided systolic dysfunction, their EF should be probably somewhere below 30. All right, great job. Hope you guys got that one. Question 2. Which patients are least at risk for developing heart failure? So, right here we have different options of who would be most at risk. When there is an at risk question on your test or on the NCLEX, I would go about it almost like a tally. So, you want to break down all characteristics of the patient they're explaining and each potential answer and see which one has more tallies adding up to risk factors for that patient. So that's what you guys should do for this one. Take your time. I'll go through the answers now, and then, like we did before, pause the slide, give yourself a minute between each question, and then we can go over the answer together. So, option A, 72-year-old female who's recovering from an MI. B, a 58-year-old male with a health history of asthma. C, 32-year-old female with a history of endocarditis. And D, a 40-year-old male with lung cancer stage 4. So, like I said before, the best way I think to dominate these sort of questions is to tally off each characteristic of the answers and see which one has the greater number of risk factors. The answer for this question is D. So, as we can see here, the question is actually stating, try not to trick you guys, which patient is least at risk for heart failure. So, going off of what I said before, the patients who would be most at risk are A and B. Least at risk would be D. He has no risk factors because he's under 45 years old, and lung cancer would not be a risk factor for heart failure. I highlighted here what the usual risk factors are for heart failure. So it's high cholesterol, high LDL, low HDL, high blood pressure, family history of heart failure, diabetes, smoking, postmenopausal women, and men over 45. Great job. Okay, so question 3. A 54-year-old male presents to the ER with complaints of shortness of breath, productive cough, and difficulty sleeping. On assessment, you note bronchi and lung bases, a respiration rate of 32, and oxygen inside of 89 on 2 liters of cannula. Which of the following lab results will confirm your suspicion of heart failure? So, we want to see how this patient's presenting. It's looking like they're in some sort of respiratory distress. It's also saying the patient's in heart failure, so it looks like they're in an acute CHF exacerbation. Is there any lab value that you know before looking at the answers that would depict heart failure? If you're unaware, it might be difficult to answer this question, but the options we have are A, potassium of 3, B, BMP of 910, C, B1 of 12, or D, troponin of 34. Like all the other questions, pause here, give yourself a minute, no longer, and go over to the answer when you're ready. So the answer here is BMP. So any BMP over 600 is indicative of heart failure. Someone in the acute episode of heart failure exacerbation would have a high BNP, somewhere in the 900s to thousands. Great job. This was sort of a more definition question. As long as you knew that BNP was indicative of heart failure, you should have gotten that one right. Question 4. A patient with left-sided heart failure is having difficulty breathing. Sorry about all the heart failure questions. Which of the following is the least appropriate nursing intervention? So we're having a patient here who's short of breath. Which is least appropriate? So we want to think about what would be most appropriate for someone who is short of breath and then look at the answers and pick the ones that is least important. We have 4 options here. First one, encourage the patient to use the incentive spirometer. B, place the patient in supine position. C, assist the patient into semi-recumbent position. Or D, give the patient their ordered water pill. You want to go through each of these each of these answers independently and see which one is the least appropriate. Pause here, give yourself a minute, and go to the answer when you're ready. The answer for this question is assisting the patient into semi-recumbent position is least appropriate. This position is truly only used for placing suppositories or getting a rectal temperature. A lot of times I see students get it confused with semi-recumbent and semi-Fowler's. Semi-Fowler's is a somewhat upright position, and that would actually be very appropriate for this patient. If they have difficulty breathing, we should put them into semi-Fowler's because that is ahead of the bed above 35 degrees. Looking at all the other options here, the patient will probably get a water pill because they have difficulty breathing from heart failure. So we want to help get rid of some of the extra fluid. The patient will be put supine just to assist them with breathing. And then the patient will probably be using an incentive spirometer to also help with their breathing. Good job. Question 5. We are taking care of a patient who's getting digoxin and is experiencing symptomatic bradycardia. A lab draw shows that the dig level for the patient is 8. What medication do you anticipate the physician to order for the patient with this dig level? So, this question is pretty much asking if we know the normal dig levels for a patient. Even if for some reason you didn't, you and we should all know that the side effect of digoxin is bradycardia. The usual reason why it's given is to control an arrhythmia and to control a high heart rate. So, if the patient is having symptomatic bradycardia, we can see that a reason for this, even without understanding the digoxin level and knowing the normal values, just taking an educated guess, the dig level is probably too high. Um, Give yourself a minute to answer. I'm not going to tell you the answer right then, even though I did give you a pretty big hint. But the potential options we have here for the right answer are A, low pressor, B, cardizem or diltiazem, C, digibind, or D, the dig level is normal, no medication needed. The answer for question 5 is C, digibind. So, like I stated before, because the patient has symptomatic bradycardia, which is a side effect of digoxin, it can be seen that the dig level is high and that a dig level of 8 is high. Digibind is the reversal agent for digoxin, and it can be given if a patient has been taking too much. Good job. And then process of elimination as well. So we would never want to give a beta blocker or a calcium channel blocker if a patient's bradycardic, because that's just going to drop their heart rate more. Question 6. A patient with heart failure is taking Lasix 4 milligrams every 6 hours standing. The patient is having EKG changes that presents with tall peaked T waves. Which of the following lab results would confirm these findings? So, this is sort of a definition question. This question is asking if we know what electrolyte will cause tall peaked T waves, and then what's a side effect of giving Lasix. So the options that we have here: sodium 118, B, BNP 610, C, potassium 6.4, and D, potassium of 2.9. Give yourself a minute here, go over what you know about these electrolytes and the medication Lasix and come up with your best response. The answer for question 6 is C, hyperkalemia. So when someone's potassium is high, the normal range is 3.5 to 5.5. When someone's over 5.5, they're actually at risk of developing not just ectopy, but ventricular ectopy, which can be PVCs, tall peaked T waves, and VFib and VTAC. So it's something that we want to make sure we're keenly alert and responsive to. Um, let's see here. All right, good job. Question 7. You're assisting a patient to the bathroom. The patient has swollen feet and is receiving hydrolysine and Lasix for heart failure. Which of the following is a nursing priority for this patient while assisting them to the bathroom? So we want to think about what both these medications can do to the patient and what is the priority assessment for them. So the options we have here are A to D. A, provide accurate I&Os. B, lift the patient up to slowly from the toilet. C, leave the patient unattended in the bathroom. And D, assess color of urine. I will help you guys right off the bat. You never want to leave someone unattended, even if they are not to be constantly monitored. Especially on a cardiac floor, syncope is very common, and you want to make sure the patient is safe at all times. Give yourself a minute here to come up with your best response. The answer for this question is to lift a patient up slowly from a toilet. So, hydrolysine, if it's given at the same moment as Lasix, it can have the potential to really drop the patient's pressure. Both of those medications are known to drop the patient's blood pressure. Hydralazine especially has a tendency to drop BP drastically. So given with Lasix, which can also drop the pressure, might cause the patient to have a syncopal event. So just be careful there. Good job. Question 8. The physician orders said to administer Lasix 40 once a day. The patient has the following morning labs. Sodium is 132, BMP 818, potassium 2.7, and B111. What's the priority? So first off, before even looking at the potential answers, look at the lab results and see what jumps out at you right away. And then you can go to the potential responses. So we have four options here. Option A, administer double the dose of Lasix. B, notify the physician of the sodium level. C, assess the patient for swollen legs. Or D, notify the physician about the potassium level and ask if you should give the next dose of Lasix. Give yourself a minute here. Go over what the question's asking and the abnormal lab results, and you should come up with the right answer response. The answer for question 8 is D. So, as we can see, one of the major side effects of Lasix is hypokalemia. So, Lasix is potassium wasting. So, since the potassium here is low, 2.7, we want to notify the physician about that level and ask if they still want us to give the Lasix because giving more Lasix is just going to drop the K lower. Dropping the K lower can have cardiac side effects for the patient. Um, and even though it's true that the patient does need Lasix because the BNP is semi-high, we just want to make the physician aware because there's other diuretics we can be giving that are potassium sparing. Also, FYI, any potassium level under 3.5 we usually treat unless considering a dialysis patient who have trouble with potassium clearance. Any little change in potassium from normal can truly affect the patient's cardiac rhythm, so it's important to draw those labs frequently. Question 9. The client admitted to the hospital with cardiovascular disease is scheduled for cardiac catheterization. Which medication would need to be withheld for 24 hours before the procedure? So we want to think about cardiac cath. We want to think about what kind of imaging is done during that. And then our potential answers here are A, regular insulin, B, glipizide, C, Prandin, or D, Metformin. Give yourself a minute here to go over which medication you think is most appropriate. The answer for question 9 is D, Metformin. So just like if you were to give this when a patient gets CT with contrast, it can cause kidney injury due to contrast that's injected during a cardiac catheterization. Question 10. A client is having premature ventricular contractions every 3 seconds. Which assessment would have least priority at this time? So we have four options here. This patient's having a lot of activity, they're having PVCs, and the question's asking what is least priority. So we want to think about someone who's having activity, what's most important, and then answer which is least important here. So A, complaints of chest pain, B, history of smoking and caffeine user, C, has a fever, and D, hemodynamic stability. Right off the bat, I'll knock off one of the answers for you. Hemodynamic stability is always important, especially if someone is symptomatic and presenting in an abnormal way. So that's always going to be a priority. And since this question is asking for least priority, that's going to be knocked off right off the bat. Give yourself a minute here to come up with the best answer. The answer I have come up with here is B, patient history of smoking and caffeine. Even though this is important to know in the history, in the midst of an potential incident, excuse me, it's not as important to know. The patient seems symptomatic in option A. The patient shows another potential cause of the PVCs in option C. And then hemodynamic stability, like I said, is always important. It's part of our ABCs, and it's something that we need to look at if the patient's having any complaints or any signs and symptoms of decompensation. B, Even though it is of somewhat importance, it's not important in the midst of a problem. Good job. Question 11, so the last one for part one. The question we have here is: a patient is status post cardioversion. Which observation would be of least priority to the nurse? So the patient was just cardioverted. So the heart was in an abnormal rhythm. It was probably high. Maybe they had some ectopy. We want to think about what's most important after this procedure. And the answer would be which is least important. So we have four options: A, heart rate; B, oxygen sat; C, sedation management; and D, nutritional status. Give yourself a minute, look at these options, see which you think would be of least importance to someone who is post-op cardioversion. All right, and the answer here is nutritional status. Heart rate, oxygen saturation, and sedation management are all pretty important. If I was to knock off nutritional status and say which one would then be the second least important, it would be sedation. The one that would be of primary importance is the heart rate because that was the whole reason the patient was cardioverted in the first place. And the second, a close second to the first option would be oxygen saturation. Because if their oxygen saturation is low, it means something's going on internally and that they're not tolerating the cardioversion. But the oxygen saturation, if the patient's meeting their oxygen demands, should be within normal. All right. That is it for my first round of cardiac questions with you guys. I hope you enjoyed this. Please let me know. Please leave a comment. And let me know if there's any other questions that you would like me to go over on different topics for either fundamentals, critical care, or certifications. All right. Please like and subscribe to my channel. Thank you.